Hi everyone, just going to wait for another minute just to see if more people will attend. It seems to be the numbers are people are clicking on, so just give us one more minute. Right, we might as well get the ball rolling. I just want to say it's a big thank you for everyone that's attending the webinar. The webinar that we're doing is called Understanding Barriers in Care for LGBTQ Men. My name is Ben Lindsay. I'm a Health Promotion and Improvement Officer, but I'm also the Men's Health Lead for Dublin North County and Dublin North City and West. Our talker today is going to be James O'Hagan from LGBT Ireland. But before I hand you over to James, I just want to highlight to everyone that the actual webinar is being recorded. And the main reason why we're holding the webinar is part of Men's Health Week. So Men's Health Week, and hopefully you can see the poster behind me. Men's Health Week started yesterday and will run all the way up until Sunday, which will be the 15th, which will be Father's Day. Each year, Men's Health has a team, and this team for this year is Shoulder to Shoulder Connecting for Health. The whole aim behind that is to raise awareness, support healthier lifestyle choices, and encourage early detection and treatment. If there is a stage that you want to find out more about men's health or get resources, I would recommend that you definitely link onto the Men's Health Forum in Ireland webpage. So I'm going to stop talking. All you can sit back and relax, and I'm going to hand you over to James. Thank you.
Hi everybody. I'm going to share my screen now, and hopefully it will display perfectly. Thank you very much for the introduction there. And indeed, like, men's health is a really important initiative each month. Obviously, it coincides with Pride, so I'm often, I would say, sort of distracted with other things during it. But I'm really happy to be able to contribute towards the planning of it earlier in the year and to ensure that I'm available to anyone across any of the organisations who are involved to be able to do events like this or speak about inclusivity for the LGBTQIA+ community. So quickly to introduce myself, a very old photograph. My name is James O'Hagan. I'm the Champions Programme Manager in LGBT Ireland, meaning that I manage all of the work that we would do relating to access to health and social care for members of our community. Very particularly, the older members of our community would be sort of my specific target because they would face kind of multiple barriers to access and care. I just like within this slide to break down, I suppose, there can be sometimes, if you're not overly familiar with the community, you can hear a lot of the language and the terminology, and there can be maybe stress sometimes about not understanding what different things mean. So I like to break down my identity because I think it sort of shows the way things kind of that sort of fall into different buckets. So my orientation is gay, meaning that I'm sexually and romantically attracted to men. I am a cisgender male, meaning that my gender at birth what matches the inherent sense of my gender that I have, and I identify as queer. And I know people have issues with that word. Some people have issues with the word. It has been reclaimed by our community over time, but I particularly like it because it connects me across the entirety of my community. It's not just that I am sort of part of the gay community and so therefore connected to other gay men. I feel that my queerness means that I'm connected right across the spectrum of people who are part of my community. I'm from LGBT Ireland. We're the national LGBT support organisation, and we work across three main pillars, and each pillar informs the work that we would do alongside the each pillar informs the work we would do in the other areas. So our main pillars are our frontline services, which includes the National LGBT Helpline, Transgender Family Support Line, Telefriending Service, peer support groups, and online chat. We also would deliver training and awareness workshops like the one that you're attending here today, and they're informed by the experiences that are raised for frontline services and what we're learning from having our ear on the ground directly within the community. And I suppose the training and awareness that we would hope to deliver is to enable LGBTQ+ people to be themselves, participate fully in Irish life. We do so by targeting sort of core and key services that people really need to be able to participate most fully within our society, and where barriers may exist. And lastly, our advocacy work. So we, I suppose, as an organisation, would work in behalf of or work on behalf of minorities within our minority community. So again, through our services and training, we understood that there are some populations who don't maybe benefit to the same extent as everyone else. So we actively work on behalf of these groups: the LGBTQ plus asylum seekers, traveller and Roma populations, LGBTQ plus older people, and LGBTQ plus families. And we do so advocating for them within the political world, and then also through delivery of training to organisations where they would be involved in. So what are we going to look at today? First of all, we're going to look at why LGBTQ plus people face barriers and what those barriers are and what those barriers look like within primary care practice. And then we're going to look at inclusive practice and what HSE staff can do to be able to address some of those barriers. So the LGBTQ plus community obviously has traditionally hasn't traditionally experienced a sort of an equality within our society. While we're notable here in Ireland for this a quite drastic change in attitudes to the LGBTQ plus people, particularly in the last 20 years, up until the 70s or 80s, the attitude for LGBT people was one of homophobia and public antipathy, and that was supported by kind of some systematic and societal attitudes towards our community that I suppose that existed with sort of the fully support of both political and major kind of organizations. So homosexuality was listed as a mental disorder until 1990, which is incredibly recent if you think about it, and was criminalized until 1993, meaning that if you particularly are an older member, and it's important to note that in both of these instances, homosexuality is understood here to really mean, or I suppose to specifically would be understood to mean sexual activity between two men, because it is LGBTQ plus men who would have in the past been sort of who would have borne the brunt of the sort of the discrimination that our community experienced. That was because I suppose many other parts of our community were much more invisible at that time, and therefore the homosexuality, the relations between two men were seen as being the main focus. And it obviously, with that sort of societal attitude, the pathologization and criminalization of LGBT identities, it meant that our community was hidden, stigmatized, excluded, marginalized, and unprotected in many ways by the society around it. No sort of direct protections existed for our community until until fairly recently. And how does that fit into I suppose the journey of Irish Pride that we've been on over the last number of years? So our society, I suppose, began the movement, the modern pride movement here in Ireland started back in the 50s and 60s, obviously, but really started garnering some support some movement in the late 1970s and early 80s. And it was an assault on a gay man in Fairview Park that really was the catalyst for a huge amount of this change, this change. So some of you, I'm sure, will be familiar with the story of Declan Flynn. He was murdered in Fairview Park by a group of young men who had specifically set out to assault gay men who were in the park at that time. Those 5 men who were really admitted that they had been in the park to do harm to members of the LGBT, to gay men who were in the park. The judge who was presiding over the case said that the case of Declan Flynn's death could never be regarded as murder because he was a member of the LGBT community. So because he was a gay man, his death could not be regarded as murder, and those people were allowed to walk free out of from that trial. And that stirred something within our society more generally to say us that we do not want to live in a society where members of a specific minority group can be murdered and we are told that their lives do not matter to the same extent as everyone else. And that inspired the first Pride Parade. And following on from that, we saw sort of changes that occurred over the preceding or over the following years. The decriminalization of homosexuality in 1993, the removal of homosexuality from the World Health Organization, the recognition of gender, the recognition of gender recognition for the trans community, leading up to more recent events such as marriage equality and Children and Family Relationship Act and hate crime legislation, which was introduced last year. But looking to this, I suppose the story that we see is that it's when violence is done to our community that change becomes a catalyst for change, or when we fight for the rights they eventually are given and won, but it is never just handed freely. So if you are a person growing up sort of surrounded by this society, you're as a member of our community or as a gay man, your sense of yourself is going to be one where who you are is always something that can be argued about, something there can be a conversation about. You do not inherently have these rights. You have to fight for them and win them above and beyond the rights of other people in our society. There is a police car flying by us just there. I hope that didn't disturb too much. But so at each juncture point, we've had to fight for our rights. And what that tells members of our community, and I suppose what it informs us about how we exist in society, is that our inclusion is conditional, and our identity makes our inclusion conditional. And that tells us everything we need to know about how we would involve ourselves or include ourselves within society. And I suppose that brings us to why I suppose it is so important that services are coming out as inclusive. So we speak about minority stress is a concept that is spoken about kind of very frequently. This notion that sort of if you live in a society where you are part of a minority group, you will sort of always consistently have consistently find yourself live in a society where you are kind of told you're an outsider and you'll inhabit some of that stuff. So it's important to know that LGBTQI+ people are not at a higher risk of having mental health issues, nor are we at a higher risk of having sort of particular health outcomes or particular sort of health issues. But we often do have higher levels of particularly mental health issues because of the social discrimination, exclusion, and the systemic barriers that exist. So when you're speaking about LGBTQI+ men and the reason why there are additional barriers that exist, those barriers do not exist inherently because these are gay men. They exist because they have been built by the society around us. And and research consistently shows that where LGBTQ+ people are supported and affirmed, their mental health is at exactly the same level as their heterosexual and cisgendered peers. One piece of research that we like to point to is from the Trevor Project, which is an organization that operates over in the United States. And they were able to show that where sexual orientation and gender identity, where an individual or a child or a young person had sexual orientation or gender identity acceptance from one adult, it lowered the rates of suicide attempts. So those protective factors and having kind of people around you who understand your identity kind of really is very important to making sure that you can kind of access the care that you need and have it delivered in the way that you need. And so to quickly look at minority stress again and sort of some of the ways in which it exists within our society. So it's those additional barriers that are faced by members of our community. And some of those barriers are heterosexism. And this is the belief that heterosexuality is inherently normal and superior to homosexuality. And it's more than just sort of, asking someone who is your partner. It's not necessarily just around the notion that kind of, you can change a form to, instead of saying who is your wife or husband, who is your partner, to be able to address that. It's this notion that LGBTQ+ relationships deserve less respect or have less integrity than heterosexual relationships. This manifests itself particularly within grief and grieving, where you would see sort of where a heterosexual person loses a partner or wife or husband. Oftentimes there is a recognition broadly within society of how important this person was in their life and how sort of crucial it is that we recognize it for that person. Whereas within homosexual relationships, oftentimes society will view them as being less, having less value, and therefore the person will not necessarily get the same support as they would potentially have needed, or would be seen to sort of be asking for more than they deserve if they're looking for that. Homophobia and biphobia, obviously a prejudice that exists within our society. We see sadly that these are on the rise in the last number of years, and indeed are being sort of allowed to have some sort of credence or acceptability. When you see the likes of Meta earlier this year changing their content moderation, their content moderation processes, so that you are now allowed to directly call LGBTQI plus people mentally unwell, or use slurs when speaking about members of the LGBTQ plus community, because there is a I suppose built-in belief that actually to have an attitude that would discriminate against an LGBTQI plus person is seen as legitimate and must be seen as being balanced to the existence of LGBTQ people within our society. There's, of course, as a result of these, internalized homophobia. So members of our community living in a society where we are told over and over again that our identity makes us an outsider, and that our difference is something that sort of legitimately allows other people to discriminate against us, we begin to turn in on ourselves and have negative feelings about our identity and about our community, leading us to adopt these sort of prejudiced views about our own orientation and identity, which can lead to enormous shame, self-rejection, and mental health struggles. And then transphobia as well is similar to homophobia and biphobia, sort of the discrimination and negative attitude that would exist towards transgender or gender non-conforming individuals. And this is, at this very moment, something that is incredibly rife within society. The conversations that are happening around the trans community mirror a lot of the extremely aggressive and discriminatory conversations that would have been happening in the 80s and early 90s around the gay community, oftentimes sort of relying on like older, outdated tropes to be able to sort of cast trans people as aggressors, or as somehow sort of trying to challenge social norms in a way that is going to damage children. And so these are the conversations, again, like this is a population of within our society, about 1 to 2%, very small population of people, but yet you see the outsized focus that's currently placed on this tiny population of people, sort of, and the way in which they are demonized and criticized. So how can this sort of manifest itself within our sort of access of healthcare? So if you feel unsafe, you're not going to access care that you need. We see that 45% of LGBTQ people feel unsafe while holding hands with a same-sex partner in public. And this shows that there is a sense within society, you're constantly on alert for where you are or aren't going to be safe. You have a hypervigilance going into everyday environments and sort of every situation you walk in. So you're making a decision and a determination in every interaction you have as to whether it is safe for you to reveal this part of yourself. And that also would exist within healthcare, and can oftentimes lead to avoidance of healthcare altogether, for fear of judgment, past negative experiences, or indeed sort of a fear that the medical or fear that sort of your identity itself will be pathologized. So 40% of older LGBT people are not comfortable being open with their health and social care professionals. And while this figure is lower among younger people, many people still feel the burden of having to come out in every interaction and constantly having to fight against a system that is built for that sort of heterosexual, cisgendered majority, and needing, every time you engage with or talk to a new person, having to share your story, tell them who you are, the fear and anxiety that sort of they aren't going to understand you, or that perhaps they're going to have negative opinions about you. And that sort of chronic exposure to this kind of minority stress does worsen and create risks for depression and other mental health concerns, which can impact overall well-being. Research has found that there is a significant rise. This is Being LGBTQI in Ireland study, which was released last year, found significant rise in severe depression, anxiety, and stress in the LGBTQ community compared to 2026. And I think that, compared to 2016, and I think that if you look at that in the context of sort of how the conversation around members of our community has changed over the last 10 years, it's not surprising that with this sort of, overwhelming wave of very discriminatory conversation of kind of, the sort of anti-LGBT, the increase in hate crime, violence against our community, that people would be feeling more and more anxious about their place within society. And there are, of course, fears that services are not going to meet their needs, or not going to understand their needs. So for example, I work alongside the National Cancer Control Programme and the National Screening Service, and they've identified that there is a risk, particularly to lesbian women, a higher risk of cervical cancer, because traditionally within primary care settings, there's an understanding that you do not need a cervical smear unless you're sexually active, and that perception of sexually active is the traditional heterosexual interpretation of what that is. So they see lesbian women as not needing or to be needing to be referred to for cervical smears, which then leads to a higher level of cervical cancer among that population, because there's an assumption made about the lifestyle and about whether or not sort of you need that care, which shows that the service is not meeting their needs. And the Mental Health Commission released some research a few years ago, My LGBTI Plus Voice Matters, which showed that LGBTI plus people feel less supported by psychiatrists and consistently treat and less consistently treated with respect in community mental health services. And oftentimes the issue was around feeling that the individuals that they were dealing with across the board in all services didn't understand their identity, or would sort of see their identity as something which had to be treated, rather than listening and seeing them as a whole person, and exactly kind of who they are. So to move on quickly to allyship, sort of who is an ally and what does an ally do? So an ally supports and advocates for someone. You don't have to be part of a marginalized group to be an ally. In fact, it's better when we have allies who aren't part of our marginalized group, people who recognize the issues that exist and begin to try and advocate for change. It needs to be consistent and ongoing. So coming along to an event like this in June is really important, both for Men's Health Week and for Pride, which is ongoing throughout the rest of this month. But sort of taking some of what you've heard here today, or some of what kind of you feel is right, and bringing that on into how maybe you deal with people over the course of the rest of your life. And it's not just a label. You can't just give yourself the title of ally, particularly at the moment where we see that there is an explosion or a growth in homophobia, transphobia around the world, both on social media and in the world more generally, in sort of the real world. It's now more important than ever that people would be sort of, proactively being allies for people. When they hear someone saying something that's not appropriate, that they're calling it out, or that they are checking in with and making sure that members of the LGBTQ plus community who they do know and understand that they're there for them and they want them to be able to live as fully as possible within society. So quick sort of demonstration as to why allyship is needed. This is some research that was done by the Oireachtas Library and Research Services into the experience of discrimination and homophobia within our society. It's from a couple of years ago, but I think that the figures, when you look at the more recent research, such as being LGBTQI in Ireland, kind of it matches up fairly well. So 75% of people who were participating in this survey, which was nearly 1,500, said that they had been verbally hurt for being LGBTI over their lifetime, and 29% said that they had been verbally hurt as recently as the 2 years prior to this research being carried out. 29% of gay men reported being physically attacked in public, and 24% of transgender and intersex people reported being physically attacked in public. So as you can see, and 15% reported being sexually attacked for 22% to 30% of the trans and intersex community. So there's a high risk of victimization and harassment, particularly of physical attacks against our community, which contributes to that sense of unsafety, which then envelops all of how you are behaving within the society around you. So if you have this sort of, you don't necessarily, and the impact of a physical attack against a member of our community, or a violent attack against a member of our community, that impact is not just felt by the individual who is at the center of that, it is felt by everyone around us, because it contributes to a sense of a lack of safety and a sense of a lack of being within our society. So as we talked about, LGBTQ plus people also feel less safe holding hands in public and less safe expressing intimacy to their partner in public. And I suppose that contributes to, I think people often like to point to the marriage equality referendum in 2015, where immediately after that referendum, there was a real sense within the community that, like, we can live our lives as openly as we want. There was a sense that you could happily walk down the road holding hands with people. And I certainly know from being in Dublin at that time and being around the country at that time and seeing gay couples holding hands or kind of being kind of, you know, intimate with each other in the way that every couple does, it really affirmed my identity and made me feel more safe. So now living in a society where that is rolled back to an extent, that contributes again to that sense of unsafety and sort of not fitting in. And quickly to look at some of these research pieces, 72% have experienced verbal abuse. This is from Being LGBTQI in Ireland, which came out last year. At 45%, as I said, don't feel safe holding hands, and 1 in 4 have been physically assaulted. Trans people have scored their life satisfaction as 5.9 out of 10 as compared to 6.3 or 6.9 among their LGBT peers, which is just directly compared to the to our community, and much lower again than the heterosexual community. So, being an ally in healthcare. This is a quote from a person who has done some of the training that LGBT Ireland has delivered, particularly working within older people services. Say, I took care of several LGBT plus residents whose needs were not fully met due to staff misunderstanding their needs. This group's care needs are underrepresented in older persons' care. And I think this is something that can be applied right across the board. Members of our community are oftentimes not having their needs met due to staff misunderstandings or uncertainty about the needs of our community or how to be more inclusive. And I think it's important to point out that, you know, it's not necessarily difficult to make yourself more inclusive. It's more about how nuanced ways in which you approach an individual. Now, I sort of broke this down earlier on, but I suppose rather than getting into the kind of terminology, because I think a lot of these concerns and anxieties come around the lack of understanding of kind of how our terminology is used in a fear of saying the wrong thing. So they can be broken down into 4 general buckets. First would be the assigned, actually I only have a few slides, so I'll send these slides on and you can read through this as well. Some of the fears and concerns that exist for members of our community within healthcare. There's the fear of coming out in care, that it may feel risky to come out in care if they've concealed their identity for many years. And that how that can impact the care is that you don't necessarily have a full picture of who this person is. You also may not be fully included in who the individuals within that person's life that should be sort of included within their care planning may be. There's a fear of discrimination and abuse. Obviously, I touched on the abuse that's existed within our society more generally, but there's a fear that that abuse can stretch into care settings where you are particularly vulnerable, and hugely the exclusion of family of choice. That sense that the people who are important to you and who matter to you are not included within your care planning or excluded at points of real vulnerability in lieu of kind of more traditional family networks where that real support may not actively exist. How can you move on from this? Move on from today, from this whistle stop tour. First is around language, understanding the language that we use in our community. I'll send some of these slides on so you can read over them, but also like trying to understand what words are used and listening to the words that are used by individuals when you're speaking back to them, avoiding assumptions. You never know a person's gender or a person's partner. You never know you don't know until they've told you sort of like how they identify. So just avoiding those assumptions where possible, creating a welcoming environment for LGBT plus patients. And this can, once you've done training and you feel more confident in being able to meet the needs of those patients, it can be as simple as wearing a rainbow lanyard or a rainbow badge. People really value that, and they see that from 1,000 paces. They can see if there's a rainbow badge up. And lastly, educating yourself. So doing research about issues that LGBT plus people face, contacting organizations such as ourselves here in LGBT Ireland, to be able to get further education, and then rolling that into your practice. So what else? Education, learn it; visibility, show it; and action, do it. Now I have hit 12:30, I believe. I had one more piece, which was just around kind of, you know, if you can within your own workplace or support the development of diversity and inclusion policies or speak to people, that can have a big difference for your co-workers as well, to make sure that people feel integrated and supported in being LGBT within the workplace, which overall will have an impact for employees and for service users, and that everyone will feel more respected and seen. A gender transition policy is something that is, I think, becoming a really key thing to have as part of different organisations, and Dublin Bus have a great gender transition policy which people can look at if they want to get an understanding of what that is or what that looks like. So lastly, being an ally, here's your checklist: using inclusive language, checking your assumptions, having our back, being visibly inclusive, and celebrating Pride, which is a really important part of kind of how we still see ourselves sort of represented positively within society. Now, that was a real whistle-stop tour. My email address is james@lgbt.ie, and I am absolutely delighted if anyone wants to email me. I would be very happy to chat to you more. But for now, I'm going to end my slideshow, and I think we probably don't have time for questions. But if there was any, I'd be happy to answer them.
No, we're literally on the dot at the moment, James. So look, James, thank you so much for doing this. I think we have a hand up, but I'm not sure if we have time to answer that question. But look, if that individual wants to email yourself or ask you directly, they have your email there. I just want to say a huge thank you as well to everyone that attended the webinar, and also just to celebrate Men's Health Week and enjoy it as it only comes once a year. Look at everyone, thank you so much again. And James, a big thank you again for doing this webinar.
Thanks very much.
Bye all, thank you.